We're Mike and Ellen Connor of Devils Lake, North Dakota, and we're pleased to be here today.
Well, originally I'm on dialysis, so I was having some problems at Christmas time, and I was with a cold and kind of coughing quite a bit. And going to dialysis, I thought that's what was happening a little bit, but I got sicker, so then the Monday after Christmas, they made an appointment for me up at our All True Clinic at for the virus. They're going to see if I had that. And I went in and I tested positive for it.
With Ellen's being on dialysis, I was very concerned about the impact of what COVID could have. And then I should add, when we discovered the x-rays came back about the same time as the positive COVID test, that in addition to COVID, she had pneumonia too. I mean, that just doubled everything. It was a spooky afternoon sitting there and we weren't in the All True Clinic. We were in the COVID section of All True Clinic. They were at a separate area. You came in a separate door, so you knew something was going on.
While I was at All True and getting the results of my rapid test, she said that she had a new deal. They were doing a new procedure, this BAM infusion, and I could get it in early in the morning, so I scheduled it for then and went up the next day then and got the BAM infusion. They wanted to put me in the hospital, but they couldn't put me in the hospital because I was an outpatient in dialysis at Mercy, and they couldn't take an outpatient as an inpatient for the hospital, so it was a little bit scary. But with this BAM infusion working so well that I got the next day, it worked out well. This infusion took about an hour and a half, and it was some kind of antibody. They called it BAM, and there was no problem with it at all. You just laid in the bed like taking a blood transfusion or something. And when you're done, you just get dressed, and of course they have to be out of the room again with all this virus and that. And the next day, I was really well. I still had the cough a little bit, but I wasn't as tired. I went to my dialysis sessions. I was very pleased with it, very, very grateful for it.
I sort of ended up as an afterthought of the testing because Ellen had tested positive, and the PA at All True Clinic said, we're going to test you too because you're more than likely going to show positive. They didn't do a rapid test on me. They did a normal test. Came back, I think the results came back in 2 days. So they called and said, you got it also. And they immediately lined me up for a BAM infusion, just similar to what Ellen had. Everything went fine. From January 7th, though, is sort of when my little side effects started up. At that time, All True Clinic, Mercy, CHI, St. Alexis, and all of the information, nobody happened to give any information on how to handle the BAM infusion. So on January 14th, the district health unit called me and said, Mike, we've got Pfizer vaccines. Come on down and get your first shot. I said, great, I'll be right down. So I went down and got the shot on that Thursday, the 14th, and everything went fine. I sat there for a half hour after the shot, no reaction. Friday evening at home, it hit me. My blood pressure went through the roof for 2-3 days. High anxiety, it was miserable. The neat thing was Ellen that day I got the shot, she was mad because she was at dialysis and they had closed down the vaccinations by the time she was done. Otherwise, she would have had a shot too that day. She didn't. It took about 3-4 days after that, and we learned through actually an article in the Fargo Forum from a doctor out in the western part of the state promoting BAM. And he said, the important thing is you have to wait 90 days from when the infusion is given until you get a vaccination. Well, I had waited 7 days, and I can assure you, I would sincerely urge people to always follow the directions, but it was nobody's fault. There was a mishap somewhere on the wait. But no, you need to get that shot, and I just fail to understand now with everything else going on that people are even considering it. If they tell me, and I know Ellen feels the same way, if they were to tell us that you should get a booster. We'll be the first ones in line.
I waited the 90 days after the infusion. I got my first vaccination, and I got the Johnson & Johnson, didn't I? That's right. I got the Johnson, so I just had the one. And I had no reactions from it, and was glad. I mean, I feel secure with it. The clinic and the hospital both were very good with working with the virus in me.
Can you imagine what we could be going through right now if we didn't have that vaccine? Should we get the vaccination? Everybody should. There's no excuse. There's nothing to worry about. I had some bad side effects, but I wasn't anywhere near a ventilator. I didn't have any of the other fears of what is going to happen to me. I've got COVID. No, I beat the COVID. So get a shot and get it done.
I think right now, with all the complications I have with my kidneys and that, if I wouldn't have had the vaccination, I would be even more worried with my medical condition. So I urge everyone to get a vaccination. It isn't just about you, it's also about the other people.